You're watching News 12 Westchester, serving Westchester and the Hudson Valley. Now, the daytime edition.
Welcome back to Daytime. I'm Chelsea Sobel, and the recent headlines involving the swine flu has many people, parents, a lot of us with kids heading back to school, very concerned. And today we're talking with Dr. Ron Neudovitz, the chairman of the emergency services from the Hudson Valley Hospital Center. And thank you, doctor, for joining us.
My pleasure.
This is a big topic. We heard a lot about it in the spring, and then it sort of, I don't want to say it died down. We didn't hear as much in the summer, but now with kids going back to school, I'm a parent. A lot of us are very concerned about sending our kids back. What's the latest on the swine flu? Is it coming back worse, or do we think it's going to be about the same as it was in the spring?
Well, the one that we had was pretty mild to begin with. We are expecting it to come within the next few weeks, and we're predicting that it's probably going to be a moderate type of influenza. The one that we've had in the past really wasn't as deadly as our regular seasonal flu, but the concern was that if it would mutate and change, that the new one would emerge as very virulent and could be very deadly.
That's the scare we've been hearing about all summer, that it could be very deadly, but you're saying that's the good news. We were thinking it might mutate, but it hasn't yet.
Correct.
Could it still?
There's always a possibility. We're basically following the information on a daily basis.
Right.
But the idea is that if it hasn't mutated, that the people who have been infected in the past with this influenza H1N1 most likely will confirm some immunity. So if they do get it, it won't be as bad. And that the medication that has been very effective against the H1N1 influenza would continue to be very effective with this new one that's about to emerge.
We'll get to what we should do to protect our children. We're talking about some vaccines, but first, how do you know you have the flu? What are the symptoms? Typical?
They are typical for the same as the seasonal influenza. Most of the people will present with a high fever. They'll have a headache. They'll be coughing and sneezing, and they'll have a lot of body aches.
Okay.
This one that we just had also had some GI effects in terms of vomiting and diarrhea. So some of the patients that we've seen have been quite dehydrated by the time they came into the ER.
And at what point do you go to the emergency room, or what's the first step? You call your doctor?
Typically, we ask people to call the doctors because we don't want to overcrowd the emergency departments and the
Right.
hospitals, because with this last one, we had so many people who presented to it. Most people who are at a lesser risk to get complications from the influenza, like the young adults, we ask them really to call their doctors. So if they're just having the symptoms, the best thing to do is just stay at home, drink a lot of fluids, and try not to go outside to infect other people.
This is interesting with this flu. Who are the people most at risk? Because with the typical flu, we hear the elderly and the very young. Correct. We were hearing about a lot of cases of teenagers and adults in their 20s. So really, we'll talk about the vaccine. Who are the people that are most at risk?
So the people who are most at risk to get complications are the same type of people, which are the very young, kids less than 6 months, and older people. However, unlike the seasonal flu, which mostly infected the older population,
right,
it seems to have gone to the younger population. So school-age kids, kids that are in high school, and kids that are in colleges are more likely to have gotten the flu and propagate it. So when we're talking about vaccinations, we're really looking to target that population rather than the elderly.
Okay, I'm a mom of 2 young children. When should I call my doctor and say, when is the vaccine coming out?
So we're hoping that as long as the vaccine is safe and effective, that the CDC will be releasing it shortly over the next few weeks, we hope. For the vaccine, you really need to get 2 shots, and they have to be 3 weeks
out, right?
apart. So it won't be emerging right away. You'll have to wait for it, and then to get the immunity may take a while. Things that you should be concerned with children is if they're very short of breath, if they're cyanotic and have bluish discoloration to their lips or face, if they're lethargic, if there's a lot of vomiting and diarrhea, and they get dehydrated. Those are the type of kids that we would really like to see in the emergency department.
Okay.
If you're just having a fever and cough and sneezing and your body's aching, those are the type of patients who really should remain at home. Call your healthcare provider to make sure that there's nothing else that needs to be offered. And then if people get better for a while, and then they get worse, those are the people that can complications like pneumonia, and then you have to come back to the hospital.
Dr. Ron Neudovitz, thank you so much for joining us.
My
Great
pleasure.
information on the swine flu. Be prepared, and we'll keep you posted, of course, on that right here at News 12. We'll be right back.